All right, just one moment, we'll get started. Yeah, we're not going to the technology issue.
Spend all that money, or they spend all the consumers on to Jimmy, I think. I do consider indicator why, because like first thing it's more like okay.
Good morning. My name is Christy Urich. I'm with the World Vision Wash team. Greetings to our Friday warriors here that are endured to the last day of the conference and came to a session at 8:30 in the morning. Greetings to those who are maybe joining us online as well. Yeah, really appreciate you being here. We knew that this would probably be a small session. It's not the most ideal spot in the agenda, but we know if you're here, you really want to be. So thank you for joining us today. You are here for the Raising the Tide for Gender Transformative Wash. So we're right here because we recognize there's a drastic need for a shift in how women are engaged in our WASH programs, and we want to share some of our experiences on what we're learning and hear from you as well. So be prepared to engage. We'll have some questions for you, but don't worry, we won't put you in breakout groups or make you play games because it's going to get along. So games is right. Yeah, so we'll be hearing from Emory University, sharing some of their work. We'll be hearing from CARE, and then World Vision will be sharing some experience as well. So thank you so much for joining us today. We had a Mentimeter set up, but then getting it transitioned to this computer just did not work. So we're hoping you can bring your experience from where you come from and what you do and help us learn together. Our first presenter will be Dr. Bethany Caruso from Emory to set us up. So pass over to you, Bethany, to get us going.
Thank you. Thank you. I echo Christy in thanking everybody for joining today after a long week, but hopefully hopefully this will be fun. I think it will. And I have to picture where's the little zapper? This is zapper. Yes.
You guys hear her back there? Do we need to lower the microphone? Yeah.
The thing is, I can't see you all very well. I thought it would be useful to start off talking about, first of all, what does it mean to, like, what does transformative wash really mean? What do some of these terms actually mean? I'm going to show a few slides that some of you I think have seen before because we've talked about this before, but I am going to transition into some other frameworks as well. But I'll go through these very, very quickly just so that we're all on the same page. There is a framework that's commonly used. It was established by the WHO called the Gender Response Assessment Scale. And this is what it looks like here. And I'm going to go through it one by one, but you can see from one end, it goes from harmful approaches all the way to transformative approaches. And so on the one end, you have harmful approaches. And this is not just for WASH. This is for any sort of development program. That's what it was developed for. Any policy, any sort of intervention, small scale, large scale, whatever it is that you're doing. Some things that we do are harmful. Even if that is not the intent or the spirit, things can be harmful. A good example of that is actually some of the work that I've done with Kelly Alexander here in CARE. We did a program in Kenya for school wash, very well intended to make these very giant, ugly rain barrels be beautiful. So it was these really nice pictures were put on them, but they only had girls carrying the water. So it's a very subtle thing, but it's a little bit harmful because it's sort of it is perpetuating this idea that that's the job of women. Sorry to implicate CARE, of course, but I mean, that was of course. Things have been repainted. Things have been repainted. Another example, I just want to put up some work by colleagues Sue Cavell and Chelsea Huggett. There's a paper called Good Moms, a gender equality perspective on the constructions of the mother and hand washing campaigns. We in WASH do a lot of work to target women because they're moms as the vehicles for carrying out various and different programs. So there's one example that they have in their paper called The Story of the Supermom. And this is a program where they have all these images of what it means to be a good mother. So you can kind of see like, oh, you're nurturing your child. I hopefully you can hear me. You're nurturing your child, you're washing their hands. They're growing up to read at night and doing their homework and things, then they become a doctor, and then they have their own child, and then your son is taking care of you. So that if you're a good mom and you do all these things, like life is going to be like really, really. So maybe mom will get a benefit when hair is gray eventually if you wash your son's hands. But I think if you have like, I think these are directly from this paper. In hygiene campaigns, different images of a good mother appear in different settings, but there are some real similarities. Like she's heterosexual and married, light-skinned, well-dressed, not employed outside the home. She's often concerned with the health of her son. She has the role of caregiver in her household. But the point, how it's related to this sort of scale is here. The good mother discourse is singularly burdens women and ties women's identities to their roles as child raisers and nurturers of others. So for that reason, it can be harmful because it can be constrictive in a way. And so therefore, if she's not complying with the hand washing, she's the one at fault, not the intervention. Then there's things that are neutral and blind. Like these are basically, I'm going to give an example of sex blindness, not gender blindness, but you can sort of see the analogy and carry it over. There's been a lot of research that has actually explored how much we report sex disaggregated data, because I think COVID revealed for some, like men experience it some ways, women experience it other ways. If we don't look at that data, we don't know. And this found over 11.5 million papers, not very good sex disaggregation. In public health, it was 54%. So you think, okay, well, maybe WASH is in a good standing. So what about WASH? One of the things that we decided to do in a recent systematic review was actually just ask that question. So for looking at interventions on the effectiveness of drinking water WASH on diarrhea, we actually found that only 5 of 124, so 4% actually included articles like this. So if we're not even, I know we collect the data, if we're not even reporting that, then you can only extrapolate out as to like all the other sort of potential blindness within there. Not to mention restrooms. Of course, like we also, there's an issue with the blindness thing of, it's called like the fairness fallacy. Well, we're trying to be fair, so we're not trying to have more for women or less for women, or never mind those who are not a part of the binary. But like, there's a really great book called Invisible Women, and this first chapter talks about how in design, most toilets have the same square footage for men as for women. But you can actually fit more urinals in that space, more places to go, not to mention the fact that women are carers. They also menstruate. There's other needs that women have. So it's not, the square footage is not proportional. So blindness can seem like fairness, but it's not. Fairness, blah, blah, blah. And then there are things that are sensitive. So moving on that spectrum, things that are sensitive are actually looking at and acknowledging gender, but there are things that are not doing anything about it. That's fine. Those things have a place. This is often research. So there's lots of studies that are basically shining a light. And this is a first step, and it's really, really important. So here are some examples of some papers that are just actually actively looking at understanding experiences of people and not ignoring gender or sex. And then moving on, we're starting to not only acknowledge, but make recommendations or do something about what we see as these gender differences. I like to share this paper it's called Making the Case for a Female-Friendly Toilet. It's authored by a colleague of mine, Marnie Summer, and I told her last week I love to share this paper, but I also think it's really silly. I think it's really silly that we have to have a paper that talks about like how to be like friendly to females in a toilet, but it's also so important. Thankfully, she agrees and didn't think I was making fun of her, but I think it's extremely important that we start to point out these things because of the blindness, we have a tendency to miss specific needs that people have. And then we get to the transformative space. And this is where we're finally arriving at me trying to finally answer this question, like, what does it mean to be transformative? And this is where it gets tricky for all programs, I think, and especially for WASH, because what these sort of approaches do are transform and address the causes of gender-based health inequities and work to transform harmful gender norms, roles, and relations. So it's kind of tricky. It's like, well, what is the role of WASH here? A lot of WASH that we've seen actually engages women to be the vehicles of WASH. In this case, a good example would be that WASH is then the vehicle for gender transformation. And this is definitely a part of what people are thinking. As part of this commission, there's a really great and bold statement that says the aim of this commission is to reimagine and reconstitute WASH not only as a central pillar of public health, but also as a pathway to gender equality and social environmental justice. So again, WASH being the vehicle. But what does that mean, and what do we do? At the very least, we stay away from that on that side, the exploitative, and we try to move in this transformative way. But what exactly is a transformative approach? A transformative approach is a little bit more nuanced than, I don't want to really read a whole bunch of paragraphs, so I have to move something off the screen. I have to look up here, but it's an active examining, and it's an active challenging to transform the causes of gender inequality. These are rooted in discriminatory social institutions. So gender transformative approaches aim to address the unequal gender power relations and discriminatory gender norms, attitudes, behaviors, practices, as well as discriminatory or gender blind policies. And by doing so, it seeks to eradicate these systemic forms of gender-based discrimination, which is what everybody who's at a WASH conference was trained to do. I know it's a huge, huge ask, and it's really, really challenging to do these things. It's no small thing. I think there are some core principles underlying this. Again, I'm not going to read all of this, but a key one are these uses of participatory approaches. We've talked about this before in other sessions, but I'll leave this here. But I also want to point out that there's an entire guide on how to do this. Other sectors have been doing this for a very, very long time. Specifically in agriculture, I should have put a QR code, I'm sorry. Agriculture and nutrition specifically have been doing this for a very long time. We should learn from and leverage the resources that they have. Some translation might be needed. But one thing that I just wanted to talk about really quickly before we pass on and move on is one approach that I think might be useful for us to think about, or one framing in terms of further reflecting beyond that rainbow scale of what we're doing and how we're doing it. And this is called the Reach, Benefit, Empower, and Transform framework. Again, this has been around for a long time, originally developed by the International Food Policy Research Institute with these first three. This transform part was added later by this group, which is focused on integrating agricultural research. So let me explain what this is. The reach part, this is a way of looking at what we're doing, another way of looking at what we're doing. These are approaches that are, they're trying to make sure they're getting to women and men. And they're inviting women to participate in reducing barriers to women's participation, using quota systems for training events and things like that. On the surface, that might seem like, oh, that's like a really good idea. We know WASH does this. We use quota systems all the time with WASH groups and things like that. We count women. But sometimes those things they're not always good. So you just have to be careful here, because just because you're reaching women and you're inviting women along, you really need to do some investigating about understanding, well, what is the experience of that person? It could be harmful. It could be taking up too much of her time or cause some friction in the home. And then, so yeah, a WASH management committee is an example. Then you think about the benefit. So you're moving beyond reach and saying, are women actually benefiting? If we have them do these quotas and come to our meetings, are they getting anything out of it? Or are we just getting out of it because we're checking a box, right? So, female-friendly toilet might be a good example of what might be something that's beneficial. These are projects that are specifically designed to consider these practical gender needs, preferences, and constraints. Benefits are really, really important to consider. I think it's also really important to expand off of this and think of well, are there the opposite of benefits from our program? Are we extracting something as a result? So yes, think about benefits, but also think about harms. Yes, it might be helpful for her health in the long run, but what is the cost of that along the way? So that balance is really important. Just by identifying one benefit doesn't mean it's a go. And then moving forward into these empower frameworks or approaches, these are things that strengthen the ability of women and men to develop and implement strategic life choices in a context where they previously could not. So we're thinking about gaining power through and influencing decisions, influencing major and minor decisions in the household, in their communities and beyond. And so their control over money could be a part of it. Again, in their household, the ability to spend money. A lot of women are able to earn it, but they don't have control over spending it. And so these are just a few of the examples that we could apply to WASH. And then the transform one goes beyond it. The first few were about women specifically, but the transform one is really about changing the world. Again, what we're all trained to do as WASH practitioners. So these are influencing changes to structural barriers and gender norms to empower women and men and advance gender equality and promote gender equitable masculinities. This is about changing unequal power relations in the home and community, changing norms around water collection, child feces management. These are just some of the examples, but these are certainly, again, hard to do. So where do we go from all of this information? Well, I think there's some key principles that we will take home from our work. And I think the first one, like the panel said yesterday, we should do no harm. That's a super low bar, but we have to be aware of what we're doing and to look in order to to get ourselves above that super low bar. So do no harm, take a critical look at current practices and strategies and make sure that what you're doing is not harmful. And if they are, change it. The next one, at the very least, we need to aim to understand those inequalities. It's possible that we just can't do something about it all the time. But if we're starting to look and see that they are there, then maybe that'll be able to help us get the funds, the support, the capacity, the tools, the teams that we need to do that. And try to go beyond reach. It's good to involve women, but be specific about why, and think about what the benefits or harms might be with that engagement. And then to really get to a transformative place, we need to design interventions intentionally. We can't like design a WASH intervention and then hope decision making is going to change in the house. And this is really where it gets tricky, I think, for a lot of us working in this space, because what that really means is engaging people who know how to do that, which is really outside of WASH. There are some people in WASH who are building that capacity, who are really great as researchers, but that is the squishy part around the edges that I think that like we struggle with. We all have the good intent of wanting to do this, but it's not necessarily always within our wheelhouse. So it means partnering with people who might be in a different sector, a different silo, a different sort of making things a little bit more interdisciplinary, strategic partnerships along the way. And that's why, so I think it's actually good for me to hand over, and I'm going to hand over now to my colleagues at CARE and World Vision, because I think one of the great things that I learned from working with them is that they've actively engaged these really challenging processes, because it's hard to work outside of water, and they've partnered with people in their own organizations and beyond to try to figure out how do we deliver integrated programs that are beyond WASH, and simply doing it, I think, is a huge step. So thank you so much, and on to the CARE team.
Before we go to CARE, we do have a couple of minutes if anybody wants to ask a question to Dr. Truesdale. Yes.
I just wanted to make a comment. I think it's sometimes more than about what the implementers want to do. It's as much, if not more, about what the donors want to fund. And the pushback that we've gotten, not only in WASH, but also in the health sector, where I and some of my other colleagues work as well, is that it's not our mandate to change gender norms or gender relations. It's not our mandate to promote or facilitate transformation. Instead, we want the outcomes that are pertinent to this field. And that's what's challenging to demonstrate the value of, and especially as we all in the room, as believers, know that they're critically interconnected.
I think it's a huge point in BT. And I think one of the things that I think that point is hopefully like the first and the start of an important conversations that we have with donors too, because I think there are interventions that can have health impact that, but also have a huge cost. And so convincing them to like rumble, like, you know, I can deal with this a little bit is a little bit, yeah, I think, but thank you for raising that. I think that's absolutely right.
Okay. Yeah. Thanks so much, Bethany. That was fantastic. No matter how many times we all talk about this, we always learn something. Can you guys come join me? So my name is Kelly Alexander. I work with CARE based in Atlanta, Mani as well. I'm here with Harsu from Madagascar and Mane from Ethiopia. And we're just going to talk a little bit about very small, specific activities that we do in some of our programs. Do I use this? What are the advanced for the?
Yeah, the arrow.
That's yeah. Hold on, let's see if I can get through this. Okay. Anyway, so in addition to what Bethany talked about, the rainbow scale of do no harm, or sorry, not do no harm, gender blind, gender transformative care uses that to self-measure programs. We report a lot of programs, or all programs, self-report where they fall on that scale. And then also it's often used to design programs as well. But we also, our slides aren't working, but we also have the gender equality framework, which some of you may have seen. It's a triangle or a circle, depending on how you want to look at it. And we try and design all of our activities to either build agency, change relations, or transform structures. And so those are basically like the two sort of main gender measurement tools that we use. We are designing our programs and reflecting on our programs. So thank you so much. I'm going to see if this works. Yeah. Okay. So this is the gender equality framework. I'm not really going to talk through it since we lost a few minutes, but I do want to talk for a second about the Akio Wash program, which CARE is sub to DT Global on this program. We're 2 years into a 5-year project. And one of the things that we convinced them to do that was really important was safety audits of their infrastructure. Also, I don't have those, but I have the tool if anybody's interested. So the safety audit is a process where we engage about 15 people from the community and we ask specific questions. Are there any concerns about reaching here? Do people with disabilities have any problem reaching this water point? Do people come here at night and feel safe? There's a whole bunch of questions that are asked, and then there's action items that are that we come up with the community at a verification meeting, basically. And to us, like, this was a huge step that we were able to have our prime, who is very focused on engineering and very focused on drilling and building and the numbers, right, of the wash infrastructure, that we were able to say, like, hey, let's look and see what some challenges are for women and for other groups that might not always be included and considered. And then this is a program in Somalia. So what we had, our program manager noticed that women and girls were not using the latrines. And so all he did was say, let's talk to them and see why. Like, it was in an emergency context, there wasn't time, they needed to build more latrines, but they stopped for like one day and said, before we build more for these people, let's ask them what we should do. And talking to women and girls, it was amazing. I mean, it was transformative. They just said, hey, put the doors that way, make sure they swing in instead of out, have the latrines be over there instead of over there. And like, from before to after they were built, like there was like a huge difference, like I think over 20% increase in people using them regularly and reporting liking them and like all of these things. And it was just like a 5-minute conversation with a couple different people. So we were really excited about that. But now I'm going to hand it over to Harsu to talk about Rano.
Thank you, Kelly. Hello, everyone. So I am Harsu, and I am here to talk about the RunWash case study. RunWash was a 6-year USAID funded project implemented by CARE and other partners. The project has ended in July. So for this project, we used the systems approach, and we included gender and social inclusion as one of the building blocks to make sure that we consider it and that we have actions towards changing these specific factors in our interventions. So part of these actions were like strengthening women's participation in decision-making bodies at national, regional, and local level. Also strengthening government capacities for gender equality and gender transformative programming through gender focal points. And we were working not only with WASH actors, but we also worked with other actors, specifically the Ministry of Population and social protection. So we tried to have actions beyond the WASH sector. And we also had tried to challenge norms at household, community, and institutional levels. We had activity approaches such as social analysis and action, where during facilitation techniques and during facilitation activities, the community's member challenge and discuss on the norms, harmful norms related to gender and social inclusion.
Can you talk a little bit about the gender focal points or the women's layers, just like?
Yeah, the gender focal points where we worked with, we identified women, but also men to be, we call them gender focal points within many institutions or organizations, government, but also civil society, local government, and also private sector. So these gender focal points, it was designed so that the activities of a project will go, even when the project ended, it has reached beyond the project, beyond the duration of the project, but also beyond the scope of the project, because these people were trained and they continue their activities in their own activities. They integrate their own interventions in their daily activities. Okay, so we not only did we had actions on gender to promote gender and social inclusions, but we also had actions in all of these building blocks. For example, here on finance, ensuring national, regional, commune budgets are supporting gender analysis and activities. We also worked a lot with VSLA. And with VSLA, because we know how VSLA really promotes women financial independence. So because in Madagascar, 80% of VSLAs are women. VSLA members are women. And we also had activities promoting financial inclusion. So it's not just VSLAs to increase access to WASH, but also VSLAs to really to promote financial autonomy and to promote empowerment, and also understanding, addressing barriers of women entrepreneurs, because we had the private sector engagement approach, and we specifically supported women entrepreneurs. We had like local seamstresses. They were producing menstrual pads, and they became really entrepreneurs. And we also had programs, activities to support them and to link them with institutional financial institutions. So we have also this social accountability mechanism to support women, youth, and people with disability. So what is important here is that we tried to have the gender and social inclusion as a factor to influence the system, but we also influenced all of the other factors to consider gender and social inclusions in their specific strategies and activities. So a final result that we would like to share from our final evaluation. There are a few changes that we'd like to maybe talk here, like changing social perception of menstruation. You can see here a man, he has disabilities. So this man he had daughters. And so he started to produce menstrual pads. So in country, in rural Madagascar, it is like a big change. A man sewing menstrual pads and providing women menstrual pads. And so gender and social inclusion, it is not just about women, it is about men and women working together and going beyond the social construct of who must do what. And so this is a kind of thing we'd like to share. Families discuss the needs of women and girls in the household during menstruation. So we had activities at community and household level. And these were among the activities to promote how to promote dialogues within the household and not to talk about the taboo, not to consider menstruation as a taboo, because in Madagascar, menstruation is a taboo. You don't talk about it. It is shameful. Women are kind of hidden when they menstruate. But with a community dialogue and with activities such as social analysis and action, it was challenged. And even local government, even mayor, and even our minister is willing to talk about menstruation. They are all men, and they are willing to talk loudly, not loudly, but to speak out about menstrual hygiene and its importance to women, but also the roles of men and boys to promote a safe space for women to menstruate. So we have these women, people with disabilities, community members are more involved than before in consultations, decision-making, and advocacy. Households have adopted a more gender equitable division of labor in project sites. So these are examples. What didn't change and still needs to? We cannot say that everything changed. There are still a lot of work to do. For example, give greater consideration to women during the project recruitment process. We can see here 67% of the Runwash project was in male, and only 33 were female. Because we are working in remote locations in rural areas, and it is very difficult to reach these rural areas. And then the means of transportation are using motorbikes. And when you are going to visit the communes, these remote communes, you have to stay there. Really living in this remote commune. And this is not feasible for women because they have their children, married, and a household to take care of, and taking the motorbikes, at very difficult conditions. So this is one of the considerations that we need to have. And also we tried during the recruitment process, when, for example, we were hiring regional coordinators, there were a lot of candidates, but when it is not in the capital, there are very few women who qualified few women. Very, very few. And even when they are qualified, we can see how it is, they are not as experienced. And it is kind of sad because it's the discrimination goes a while back. They were not given the same opportunity as men to go to the universities, to have as many experiences because they had children. So instead of continuing their careers, they had to stop at some point. And there is also the strong consideration that women should stay at home and take care of the household. So these are very systemic change that will still need to be addressed. So these are things that need to change. And now I give the floor to my colleague, Hamid.
Thank you. Thank you so much for the opportunity. I'm Mani Halisha. I work for CARE in Ethiopia in the food and water system. So the experience that I'm going to share is one of our projects in the northern parts of Ethiopia, where we use wash for addressing food insecurity. As well as transformation of gender. So the main objective of this project, of course, was to ensure food security and improve resiliency of chronically food insecure communities. But in this area, as you can imagine, while such situations are happening in the community, the most affected are women, because of the double, responsibility that they have in the household, and also the responsibility to take care of the family and cover different activities. So, the objective of this project was one, we have to address the water and sanitation issue. And when we talk about the water, it's not only for the domestic water, for drinking, but also for productive uses. And also, as I mentioned, we have to also deal with empowering marginalized groups. When we say marginalized groups, it's quite often women, girls, and persons with disabilities. And the other thing is because CARE is an NGO which stays in a project area for quite limited time. And those government organizations and communities are taking care of the activities to sustain whatever we are starting in that area. So during the project period, it is critical to strengthen their capacities and ensure learning adaptations are created in that area, and accountability mechanisms are also put in place. So these are the kinds of things that we have tried to do. So I will come and share what were the things that we have done in that area. But at the end of the project period, what impacts the SWIFT project have, registered in that area includes, for example, access, increasing access to water for the drinking purpose, as well as for productive use. And also, I haven't told you at the beginning, the area, communities were much more reliant on the government's food, what we call PSLP, the food aid program, because it's only 5 months of the year that have got households have enough money to feed the family. Otherwise, they have to be supported. So this is also something what we have been trying to improve, and within the series project that we have been able to, improve that to make it at least to 8 months. And because water has come closer to home, and other activities such as fuel saving stoves are introduced in that area. We have been able to save some time for women to engage in another activities like income generation activities, participation in women group, and hold leadership positions in the WASH, natural resource management, and things like that committees. So that was one of the impacts of the SWIP project. And we also, the project also registered women started to engage in financial decision-making at the household level because they have been engaged in the village saving and loan association groups at the community level, where that took them to income generation activities. And when they have many their own, they can negotiate what's happening at the household, be it decision-making where students should go, whether they should be given to marriage, whether an ox should be sold or not. This kinds of things were not happening before. But when the men started to have or earn some money, their power to discuss the decisions of financial issues has also improved. And the other thing is, one of the critical points that we have learned in that community, where there is this misconception that women are not fit for leadership at all, be it at community level, household level, and so on. So what we have been doing was, one, we involve them in the committees that we are forming.
The next one.
Okay. Sorry. And also making sure that they have got the skills and the capacity to fully participate in this committee. So their participation and the acceptance has also increased their leadership acceptance. And we have also noticed mainly picking up workload at the household level because of the social analysis and action discussions that we have within the communities. And also people have a better relationship with the government because of the accountability mechanisms, community scorecards, trainings, and so on that we have instigated in the project. Oops, sorry.
These are a lot of things you already mentioned.
Okay, thank you, sorry.
Yeah. So thank you so much, Moni.
Just one thing that I didn't mention is, when we do projects, development projects, quite often we do assessments to know where things are. For example, if we want to develop a water point, we have to know where the water sources are. So what has been integrated in this project and in quite a lot of our projects is one of the assessments we do is a gender-based assessment to see where the condition of women are, where is the relationship, what are the norms that they, that are holding them back from the rest of the society, and then putting those findings in our implementation plans. Thank you.
Thanks so much. Those are fantastic. I appreciate it. You can tell that I made them do it last night. So, one thing that Bethany mentioned, that picture of the bathroom and men and women's bathrooms being like equal in terms of square footage, and like talking about this social analysis and action groups and men taking action after they were sort of just part of the conversation. Like it's basically people not realizing that there was inequality or inequity, right? Like it's not like anyone was necessarily thinking, oh, I don't want to help my wife. I'm just going to sit here under this tree and drink this beer because I'm a man. Maybe they had not been exposed to the fact or even thought about, oh, she does these 19 things while I do one. Like it's not like a negative, intent. You know, sometimes it's just when you share and when you talk about it, then you realize what you don't know. So, if I have a couple minutes, I just want to see if anyone in the room has like tried to do different gender activities that worked really well, or maybe ones that sort of you tried and didn't really work really well, or sort of backfired. Nobody wants to share, okay? Well, we can talk about, you guys can go and we can see if.
I'd love to ask a question. Maybe do others have questions? Can I ask you a question about whether you do any? I'm always really interested in, like, there's one thing we can do, which is influence our own organizations. And I just wanted to ask you a bit about whether there's anything that's happened within Ken that you think has kind of made this approach to programming work better. Like, I don't know if I'm describing that clearly enough, but just your experience of whether changing the organization inside actually also promotes you and makes you more able to do this kind of work, because that's definitely so incredibly hard.
Yeah, that's a great question. Stephanie or Ms. Batch, you guys want to address that question?
Sure, like for example, for like for example, for care to get out of whenever we have the opportunity, will be provided with different training. We will also different training to reflect, to argue to the adult, so that we answer if our gender bias may be conscious or unconscious gender bias. So staff transformation programming, and also at the organizational level, we have also developed our HR practices. Whenever we do recruitment, we be like very gender sensitive. Like looking at building CVs, and also when we have interviews, we make sure that we have gender advisors. So we're very much critical of gender in organization and also in the program.
This can be for Bethany or Carol or Vision, but in the gender responsive scale where there seems to be a really fine line / tension sometimes between gender sensitive responsive and gender harmful actually, and perpetuating norms. So like in the example of the public toilets, where you've got the really long line for women, if you talk to them and they say, well, it'd be really nice if we had more square footage, if we had like potties for young children where we're doing caregiver work, or I don't know, diaper changing tables, any of that. And you say, okay, like I want to give you this. We talk to men, they don't have those same needs. You're giving women what you want, but you're also maybe perpetuating this norm that they are doing the caregiving work. So what question should we as a sector be asking ourselves to make sure that we are falling on the right side of that, but also still meeting women where they are and giving them what they need at that moment?
I mean, I think that's I think it's a great question. It kind of feels like a chicken and egg sort of situation for sure sometimes. Yeah, because you don't want to perpetuate norms, but you do want to provide. But I think that's where it depends on, that's like the difference between coming in with a top-down solution and working with people about what they need. Now there's changing rooms, tables in both men's and women's rooms, which is good. But I think that there's so many different intricate pieces that are like that, I think, for sure. Also, like the other thing is like, women want to be good moms. It's not that it's not that they don't want, and men want to be good dads, and people want to be good family members, and people want to be good carers. That's not like that. That's not part of it. I think sometimes the bigger challenge is when we actually exploit that role for the benefit of a project, for a project outcome. And so that's where I think that those are the first easy things to say, to like identify, is just say like, well, you're the person I'm going to do. Don't worry, this is low cost. It'll only take you 5 minutes, and then you have to wait 20 minutes, and then you have to start again in 5 minutes, and you have to filter it again in 5 minutes. It's only 5 minutes, and it's really cheap because we don't value your. So that's where I think like those are the easy wins, or things to like knock off. These other ones are more tricky, and I think I don't think coming up, we can come up with solutions.
Yeah, I think that's a great question, Madeline, and obviously a great answer, but one, the small thing that we try and do is we were doing IEC materials, you know, the comms materials, we try and have pictures of men wiping someone's butt. Or, you know, we have pictures of men collecting water, just small things to either like start the conversation or to take away from the picture of the girl always collecting it.
Great, thank you. So that's a pause in the questions, not an end for questions, but we'll keep moving forward. So yes, I get to share very briefly about a program we have called Beyond Access. So I love, Bethany, how you mentioned Beyond Reach, because it's kind of a similar concept that we are living into a bit at World Vision. And it's one example of a way we're trying to apply more gender transformative principles into our WASH programs. It's definitely a learning journey. So I'll share a bit about the vision and what we're trying to do. We'll hear from my colleague Nobuthe from Zimbabwe, who will share her specific experience in a country program. And then Emily Ogutu from Emory, is going to talk about our efforts to learn and to, which goes a little bit to your question, I think, of, you know, how the organizational change and also the need to, so a few of the questions actually, the need for organizational change and the need to be adaptive. So we're being responsive to immediate need, but also thinking ahead for more transformative infrastructure and environments in the future. So what the program is, it is a 4-country program in Kenya, Zimbabwe, Honduras, and Guatemala. Our planning year was in 2022, and we're implementing 2023 through 2025. So we're in the middle, so I won't have a lot of outcomes to share, or any outcomes to share, but we will in the future, hopefully. So the vision of the program is for the sustainable empowerment of women and girls through transformative WASH, economic empowerment, and access to microfinance. So this is not just a WASH program, but is a way that is within our WASH program at World Vision, we have we work for a long time very access oriented. And that is something that in our current strategic plan, we have worked really hard to shift, to think a lot about key areas like governance and finance, gender equality and social inclusion, and other things beyond just the pipes and toilets. And also, we think it's very important if we want to be transformative, it can't just be, we can't only be thinking about WASH. WASH, you know, we have a limited remit. We only have so much that we have control over. And if we're not integrating well, our impact is also limited. So we're not integrating with all of our World Vision sectors, but we are integrating with our economic empowerment colleagues and trying to build an intentional and sequenced program that we believe will have the most transformative impact, but we're learning and adapting as we go. So how do we describe empowerment? I shy away from calling it a definition, but it's a description. And we think about it as women and girls experiencing an increased sense of self-worth, an ability to determine their own choices, and a right to influence social change for themselves and others. So really trying to describe sort of their internal sense of value and being able to have the freedom to live that out in their household and in their community is what we're aiming for. So we group our interventions in a sequence, as I mentioned before, and we group those into steps. So the first step really is that access-oriented step, that dignifying, enabling environment that promotes safety and health. That is not something we are moving away from, but it is something we're seeking to move beyond, but it is an essential foundation. But before we even think about WASH infrastructure, we want to build on a foundation of healthy mindsets. So we're doing intentional interventions to focus on empowered mindsets for both men and women in the community. So that's the first step. And then we move on to household WASH, including water access in particular, and then economic empowerment through savings groups. And then from that, on that foundation, we move to step 2, which are opportunities for women and girls to learn and use those skills. So building on transformed or empowered mindsets, we hope to enable people to feel that they can use their voices in local level advocacy, advocating with their own officials for the change they want to see. Then we also focus on household sanitation and hygiene, particularly behavior change, using nurturing care groups to reinforce healthy wash behaviors. We're looking at school wash behavior change as well. Some of you may know we have a partnership with Sesame Workshop that has a really great curriculum focused on health and hygiene behaviors and also puberty and menstrual health. So we're implementing that in schools and building on economic empowerment with locally appropriate financial literacy and business management training and income generating activities as defined by what women say they need and want in that community. And then step 3 is the point at which we hope to reinforce and just go back and support and sustain as we sort of move toward our 3rd year of the program. And then for women who want to grow their businesses or want to invest more in their households and are able to access credit and pay it back, we want to provide access to microcredit. That's obviously not, everyone will not be at that point by the end of this program, but for those who wish to and are capable, we want to make sure they have that access to additional funds so that they can expand their businesses if they choose to start a business. And all of this we hope to do and model. And so it's not just about what we're doing, it is about how we're doing it. So we are trying to implement with an informed lens around gender equality and social inclusion, and also thinking about transformed mindsets. So this is not, this is something, as I've said multiple times, we're learning into it. We are getting a proof of concept that this is a better way to implement programs. As a multi-sectoral organization, we have the privilege of being in communities for a long time and doing a multitude of interventions in a community. But as I think your question was, we're dealing with different donor priorities, different time sequences, different reporting plans, all sorts of different silos of things. And so it can be an opportunity and a challenge to try to integrate those things together. And the funding that we have through our donor Clean Water here is really trying to put some glue and mortar between some of those things so that they can be more, have a stronger foundation to support women and girls. But as we learn into that, we do have an intentional learning approach over this 3-year period. So our objective is to understand the impact of these intentional activities to increase empowerment. And we have 4 key sort of buckets that we put that learning into. One are our surveys, but we're using sort of enhanced surveys. So it's not just access related baselines and things like that are more getting benchmarking, as Nobuhle will talk about momentarily, that we can measure at the beginning, middle, and end so that we can see areas of change. And then we're working with Emory University on other aspects of research, one including formative research, which will deepen our understanding of context. Emily will be sharing about that. Then we also will be doing process evaluation so that we can ensure implement fidelity to our models, or assess, I guess, fidelity to our models, and also feedback from participants so that we know that we're implementing in a way that works for them. And then, of course, synthesizing the learnings and sharing with ourselves, of applying that back into programs and sharing it with all of you in the future so that we can all raise the tide together. So that's the end of my comments. I'll pass to Nobuhle to share a bit about the experience in Zimbabwe, and then we'll move from there. Yeah.
Okay, good morning. I'm Nobuhle from World Vision Zimbabwe. I think my colleague Chris has already shared on just the design of the project, Strong Man, Strong World. I'm going to talk more on how we've done it so far. We are now in the middle of the project implementation period. One of the interesting things about the Strong Man, Strong World is that we're integrating WASH and livelong. So as the foundation is for us to identify the gaps of disempowerment. And through that, we had to do a baseline where we're now benchmarking at different levels, at individual level, household level, and societal level. through that, that's when you can now identify the indicators which are contributing more towards this empowerment at those levels, so that you are able to address the gaps at all levels. For instance, if we are to pick an indicator on leadership in WASH for women, so if you identify an intervention to address that without addressing the household and individual level, you are bound to fail. So it is through this baseline where we're now benchmarking to say at individual level, which indicators are contributing more on this empowerment of women. So I picked a few. There are a number of them on as indicators of this empowerment. So the first one, they were for the intrinsic attitudes about WASH roles and responsibilities. So that's one of them which we then identified to be contributing more towards this empowerment of women. So then we can now identify different approaches which we can now use to address that indicator. So benchmark, where are we in terms of intrinsic attitudes now? Then midline, we also check that, and at the end, we also check that. But it has to be done in an integrated approach. Because a woman is an individual. A woman belongs to a household. A woman belongs to a what? A society. So you have to approach it in an integrated way. So that's how we did it in terms of benchmarking our indicators, so that we know where we are and where we are going, and we're able to measure our progress towards women empowerment. That's all I can share for benchmarking there. So at household level, with indicators like input into decisions about water expenditure, the workload, then the time for collecting water, work balance is also looking at the 24-hour clock of the woman. How many hours is the woman contributing towards economic activities? And what is it that we can do so that instead of spending more time on collecting water, more time is spent on economic activities so that they are economically empowered at the end of the day. So that's who. So this program is more like integrated. Personally, I've learned a lot through this program. I've been thinking WASH is all about access, but I've learned to go beyond access. Speaking into a theory of change, if then thus, at least now we are now moving from then to thus, which is transformative change, transformative JC. So with Strong Woman, Strong World, we are looking forward to transform the lives of women, to transform their well-being. Now it's starting now. Yeah. Okay, Christy has mentioned that our first step is enabling environment, where we prioritize intervention to address and bridge the disempowerment gaps, which can only succeed in an enabled environment. So through identifying our indicators, also to mention that as we do our benchmarking, we also integrate the WASH indicators and women economic and agriculture indicators. As we mentioned that we are integrating WASH and livelihoods. So we now need to even integrate our indicators also to see how they affect each other towards economic empowerment. So when we do our benchmarking, we are looking at the WASH indicators, and we're also looking at the what? Women economic and agriculture indicators. So we then prioritize intervention to address and bridge the disempowerment groups of both WASH and economic empowerment. Then we also use different approaches to change the mindset and culture of people at all levels. Mindset change has to be targeted at all levels. Speaking to the government, just the government structure, the government system, there's need to change for the government itself to know that we can now go beyond what? Access. So there's need to change from government, even at organizational level. Our own structures within the organization, they need to change their mindset that we can go beyond. With WASH, you can go beyond access. Then also at community level, at household level, women empowerment it's a complicated one. When we talk of strong man, strong world, every man will always ask, what about men? Then we have come up with a phrase which said, strong men supporting strong men for the strong world. We are not leaving anyone behind. So really, it's a lot has to be done on mindset change, because men also think we are left behind, or men also think we are trying to take the power. But we are saying we are just trying to improve women to get the same level, and from them we can start moving ahead. Then we also cultivate the attitude of going beyond access in WASH interventions at all levels. So we are using different approaches on enabling environment, some which were formulated at World Vision level. There's the one which you call the empowered worldview, where we are saying empower the mind, empower the heart, and then empower the pocket. So we are using different approaches there to enable the environment. Chris has also talked of school-based approaches like the Girl Talk, where we are now instilling confidence in girls, because as we are saying strong men, strong world, we are not leaving behind the girls. The girls are the future women. So as we work with women, we also work with girls so that they are the future strong women. The basis of the Strong Man, Strong World project is integration. WASH being the enabling technical program, we then integrate it with livelihoods. So integration. As World Vision, we have for different technical programs. So we have WASH, livelihoods, nutrition, health, education. So we also integrate WASH with livelihoods in this project, and there is need for a lot of coordination. Because as I have been doing WASH, but since I started doing Strong Man, Strong World, I actually believe I belong everywhere. Because I'm driving Jesse, and Jesse is everywhere. There's no one who's talking Jesse who can say, I'm doing Jesse, but I cannot talk of WASH because I'm a lively person, because these sectors are interlinked. One sector being affected then affects the other link. So it's so important for us to formulate strategies and ways where we can work so that we, at the end of the day, our project are just transformative and improve the well-being of women, girls, and men in our communities. So our approach is integrated, but there are challenges in integrating. What it's us as people implementing, and even the people we are targeting at community level. Challenges are there. One of the challenges which we've been coming across is the stakeholder management. Where we are integrating WASH and livelihoods, there's the Ministry of Water, Sanitation and Hygiene, which is working on its own. Then there's the Ministry of Agriculture. Now, it's not easy to take the two and make them one for the purpose of just transformative. So it's really a challenge which we are facing, but we are learning as we go, as Chris has already said. Then also stakeholders as individual ministries, then the mindset change is a process. That one will keep working on it as we go. Then also changing the mindset in terms of thinking just beyond. As a ministry, as we ensure access, have you ever thought what that access can take people to? And to what level are they taken to? And it has to be sustainable. In such a case, if you develop me to this stage, it's a stage whereby I won't go back to where I was. If I was poor and you transform me to be economically empowered, there shouldn't be a time when I'm then slide back and become poor. On that case, I'll hand over to Emily to share the ways we've integrated and then thank you over to you.
Thank you, Nobule. Thank you, Christy. Thank you, everyone who has presented so far. I'm Emily Ogutu. I work with Emory University. So we've heard from Christy and we've heard from Nobule on the programs that they're implementing on the Strong Women, Strong World. And so I'll talk about what we are doing as a learning partner with the World Vision. So for the Strong Women, Strong World, the hypothesis is that Strong Women, Strong World interventions will increase women empowerment and improve women's well-being. But then, how do we get to know this? How do we get to get a deeper understanding of how the program will then impact on women's well-being? So what we did as Emory University is that we worked together with the country teams in the 4 countries that Christy talked about. So we had webinars with the country teams, especially the implementation teams, and had discussions about what they thought or what they felt were the most, the problems or the challenges that they have in terms of implementing Strong Women, Strong World within their area programs. So other than the webinars, we also had an opportunity to visit these countries and to see by ourselves, to talk to community members, and also just to get an understanding of what the community members thought were their challenges or barriers or facilitators to achieving WASH and economic empowerment. So from that, the country teams came up with the different questions that they felt were critical or that they felt were important to ask and to address so that these challenges would be addressed. So we had different webinars with specific countries, like we talked with the country teams in Zimbabwe, we talked with country teams in Honduras, Guatemala, and Kenya separately, and each team came up with all the questions that you're seeing there. So based on that, we came up, the team came up with 3 main research questions. And the first research question that the teams came up with, which cut across the 4 countries, was what are women's experiences collecting water and engaging in water activities for their households. And so to justify that, Strong Women, Strong World program hypothesizes that improving water access is necessary to engage in economic empowerment activities. And I think we've read a lot of papers that really show that this is a need, this is a problem. And just to mention one, I remember reading a paper indicating that women spend 200 million hours per day just collecting water. And that's a lot of time. If that time could be reduced, it could be, it could be converted to other things. Women can engage in other activities, including economic activities. So then if that is the justification, so we feel that there is a need to get a deeper understanding of women experiences collecting water. And this will help us test the hypothesis of Strong Women, Strong World. And also with this, we get to know the true experiences and also understand the variabilities by locations, and use this information to inform the interventions, as well as to improve monitoring. And so for this, which approach do we use? We used an approach called Go Along interviews or water journeys. And in this approach, our enumerators accompanied women to the water sources. And we observed the activities that women are engaged in as they do their water collecting activities. At the same time, we track the time that they spend going to the water source and back. We also track caloric expenditure. We also track the pace or elevation that they go through, as well as also we all do this to quantify the time, as well as to quantify the labor that the labor that is involved in those activities. We also observe the terrain. We also observe like the other activities that women are engaging like if they're taking breaks while going to collect water, if they're carrying children along the way, or if they're engaged in other activities like collecting firewood as they go or as they come back from the water sources, or even if they're carrying other things like laundry, we observe all that. We also observe the terrain, and also like as enumerators accompany these women, they also engage in women always engage in conversations. Like if they're going to the water sources as a group, they engage in conversations. So our enumerators are also listening to such conversations and just trying to make it feel normal to them, so they could continue doing what they do always as they go collect water. And so we also we also weighed whatever women were carrying. For instance, we weighed their water the containers that they used to carry water. We weighed these before they go to collect water. They get at the water source, collect water, and then we also weigh this when the container has water. Other than that, we also weigh the children that they carry on their back. We also weighed the laundry before they're clean and after they're clean, because again, when they go to clean them, they carry them while they are wet to go and dry them at home. So that adds more, let's add more weight to what they carry. So you find that sometimes a woman is carrying water on her back and then also having wet laundry on her head. So it's like a lot of weight. And based on our tracking, we noticed that women walk for like 9.8 miles in some instances. So you can imagine somebody carrying 20-liter jerrycan full of water on her back and like a load of wet laundry on her head and walking 9.8 kilometers. So it's like their time is spent around water collection all the time. So we did this with approximately 25 women in each community. Yes, so I talk about tracking time and tracking caloric elevation. I assume that most of us are familiar with the smartwatches. Yeah, so we had two smartwatches. One would be worn by the mother or the woman who is going to collect water, and then another one would be worn by the data collector. So this was just a backup case, so that if in case one of the watches failed to work, then we have information from the other watch. So we think this was really critical because, like, before the women left their households, we would like turn it on and then have it on throughout the journey until they come back. And the watch would capture all this. The watch would capture like caloric expenditure. The watch would capture the distance, and also like the other aspects, like the heart rate, on the watch would capture all that. And we feel that was really important because, again, I don't think if much has been done in terms of measuring the actual burden that women shoulder when they're collecting water or when they're doing water collection activities. And we think that that is really important, just to measure the actual burden. We keep on talking about women spend more than 30 minutes collecting water, but we don't really understand the actual burden that they go through. And also, like, just observing the terrain and the accidents that they go through, like in one of the water journeys that happened in Kenya, one woman broke her leg when she was going to collect water. It was like the terrain. And so that is, those are the kind of things which are not really measured out there, the kind of things which are not reported. And we feel that those are quite important to be reported. So for our second research question, we were looking at women's experiences of economic engagement, as well as if water collection is a factor. So the hypothesis was that improving water access is necessary for women to engage in economic empowerment activities, but it's really not clear if women will participate in economic empowerment activities if water access is improved. That is just what we think. One, we don't even know if they will use those access points. And two, even if they use those access points, does it mean that these hinder them from doing other things? For instance, women take these water collection activities to be part of part of what they use as a social time, for their social time. So will that like deprive them from having their social time? So we need to understand that. And with that, there is a need to understand women's engagement in economic empowerment activities, including potential barriers and enablers, with specific attention to the role of water. So once we get to understand the barriers and facilitators to water collection and how these link to economic empowerment activities. And so with that, there is need to understand women's engagement in economic empowerment activities, including potential barriers and enablers, which with specific attention to the role. So our approach to this was to conduct focus group discussions with women, and we did this with 6 to 8, or at times we had more than 10 women. We had at least 10 women in a focus group discussion. And we did 2 focus group discussions per community and in different communities. And so our third research question was, what are men's perception in Strong Women, Strong World programming? Nabule talked about men participation and not leaving men behind. So we really wanted to understand how what they perceive, what they think about having women engage in economic activities, what their perception is. And so with that, there was a justification that improvement in water access is necessary for women to engage in economic activities. And it is even not clear if men will perceive that as important. And so there was a need to have an understanding of the same as well. So we also had focus group discussions with men to get to understand all these experiences, all their perceptions about women being engaged in economic activities. So we went to 4 countries, as Christy had mentioned. So in each country, we had 2 program areas. We went to 2 program areas. Each program area had 3 communities. In each program area, we visited 3 communities. So in 2 program areas, we visited 6 communities, with the exception of 1 where we visited 7 communities. So and so for each country, we did all that. So if it was Guatemala, we visited 2 program areas, 6 communities, Honduras, the same, Kenya, the same, and Zimbabwe, the same. So those are the countries that we visited and the communities that we also visited. So I'll leave it at that point in case you have any questions about what we did. Feel free to reach out.
We have time for questions for anybody who presented. We have not a lot of time, but 3 or 4 minutes. That's great. After the master.
Yeah, Ray Norman, with World Vision. Really thank you for we're looking forward to seeing these results. You piqued our interest here. But a general question for all the speakers, especially going back to some of the speakers we talked about transformative wash. One of the things that was surprising, seemed to me to be surprisingly missing in what I've heard today is that of religious perception on gender equality. I didn't hear that mentioned, and that I seem to have encountered that myself as an issue. I know, Christy, you and I have talked about this, but 85% of the world's population designate themselves as religious, and in the communities where most of us work, that goes above 90%. So whether it's a Christian, a Muslim, a Hindu, or a Buddhist community, there are those religious values do influence perceptions on gender equality. And what are we doing about that? When World Vision started really talking seriously about Jesse, you know, I begin to notice in the field that some of our staff members, especially the men, would be going through the actions, but they weren't really convinced. Now, World Vision is a faith-based organization. We're a Christian organization. And I found that some of our staff, you know, personally kind of struggled. Well, we'll do this, but I'm not really sure where this fits in my personal theology. And so when we were putting together our recent Jesse guidance, you know, I really pushed that we need some type of theological framework, because as a Christian organization, what do our values say to gender equality? Actually, Christy did a wonderful job of articulating and crafting a piece on that. But my question is, you know, can we also get experiences? Can we get help from the Muslim community, Buddhist and Hindu communities and others on this? And what are we doing about this? And the last thing I'll mention is that a few years ago, we convened a meeting of all the senior Muslim and Christian leadership in West Africa. So we had the senior imams, senior pastors and priests come together for a week to talk about WASH and how faith leaders can advocate for help us with advocacy in our WASH programs, especially around hygiene. And we would meet separately. The Christian leaders would meet in one room, the Muslim leaders would meet in another room in the morning, and in the afternoon we'd come together and compare notes. It was a wonderful experience. But I was surprised that after one of those meetings, the imams, these are the senior imams from West Africa, came back and said, you know, we on our side, we have a gap, because religious leaders in Islam are primarily men. So how do we reach women? How do we help to empower women if it's only men who are, you know, among the faith leaders? So, you know, I thought that was fascinating. So my question is, how do we get at some of these issues of, you know, religious values that drive our staff and also the communities? What are we doing about it? Are we really trying to learn more? And are there experiences beyond my experiences with the Christian and Muslim communities? Are there experiences from Buddhist and Hindu and other religious communities on it?
Way to ask me any question when you're like 2 minutes. What do you, Karen?
I mean, I think it's a great point. It's outside of my wheelhouse to answer your question of how religion addresses gender. I think it's a really important one. And I think that it seems like the work that you did is remarkable in getting people together. And it seems like that group probably has a closer answer than somebody in this room might, but I think it's hugely important. And I think yet there are many things that intersect with gender, and religion is a powerful one. And certainly, what I think is incredible about World Vision is also that you recognize that, but also as a Christian organization, when you work in places that have populations that are not Christian, you work with the people from where they're from and religions that they have. So I think that's a really important point. I wish there was a quick answer to that.
For us, as you said, most of the norms that we are identifying at the beginning of the project are most of the norms are limited or their roots are from religious activities and practices. So we integrate the program whereby we invite religious leaders to sit together and we give them some trainings. But it doesn't mean that, whatever trainings that we give or the facilitation we do is bringing changes. There are areas where we have grown, successes, but there are also norms that are not moving anywhere. So it's a bit of both. And especially if the religious leaders are middle-aged or younger, the chances of bringing them on board is much more easier than those who have been there for a long time. But yes, we have even a facilitation guide for Christians only and things like that. So there are efforts on the ground.
Okay, for the sake of time, I'll pass to Dr. Crusoe to maybe wrap us up, and then if we'll linger, I think, for further discussion, but I think people need to go, so.
I mean, the wrap up was just going to be, I just more to thank everybody. I'm so personally energized by the work hearing that everybody is actually doing, and just the transparency and recognition that this is hard, and to share that back. And I think that helps us keep learning and continuing to ask hard questions like Greg Norman asked, to think about, or like also thinking about the question that Aditi said, like we all, everybody in here is here because they want to learn and they want to have good intentions and how to do this right and at the minimum cause no harm, but we're still figuring it out. And I think that's a really useful thing to sort of struggle with it and think about what's hard and how we can keep learning together and sharing together. And I love seeing these great organizations come together and see the similarities of what they're doing and how they're trying to do it, and the principles of working internally inside their organizations and externally, and that we have the privilege of working with them and trying to do the same on our own teams. So thank you all, and I hope you have a great rest of your day.
We brought some resources if anyone wants, so.